When I was studying medicine undergraduate, I had a penchant to study the rare syndromes and different names. I'm sure some of you have that kind of inclination. There's one such syndrome called as Brugada syndrome, and this MCQ is on Brugada syndrome. It is characterized by disturbance in the cardiac electrophysiology. Genetic defect of which of the following is responsible for this syndrome? So there will be ionic fluxes responsible for cardiac electrophysiology, and which channel is defective resulting in this syndrome. And the options are sodium channel, potassium channel, T-type calcium channel and L-type calcium channel. Want to take a guess on this? Okay. Some of you might be thinking potassium channel because very often cardiac arrhythmias result from potassium disturbances. But no, the answer is sodium channel. Let's understand this sodium channel. There is a super family of sodium channels which goes by the name SLC, solute carriers, and this one particular channel, NAV 1.8. NAV, that is sodium voltage gated. So obviously it's a voltage gated sodium channel, and it is a tetrodotoxin resistant sodium channel. Yes, what's so special about this? We have heard about this voltage gated sodium channels in the nerve responsible for impulse propagation. Even in the heart, for example, there are these channels. What is so special about this channel? Okay, it is tetrodotoxin resistant sodium channel. That makes it unique because you know tetrodotoxin is a specific sodium channel poison. It is found in the puffer fish, from which a delicacy is made from that particular fish. But then it's a very potent nerve poison in the sense that tetrodotoxin blocks the sodium channels, voltage gated sodium channels in the nerves, and therefore it stops the impulse propagation. So it results in the tingling, numbness, etc. Right. Now, specifically this particular channel, NAV 1.8, is expressed in the dorsal root ganglion. Dorsal root ganglia in the type C nerve fibers which carry the slow pain or chronic pain. So when these fibers start from the periphery and they carry the slow or chronic pain, just before entering the spinal cord, there is this dorsal root ganglion, and you find these NAV 1.8 channels in this DRG, dorsal root ganglion. Now this, what is this channel? What is the unique feature for the channel? It remains available for excitation and generation of action potentials even when the neurons are in a depolarized state. That's very unique. You know why? Because look, normally when the nerves are in a resting state, the sodium channels, voltage gated sodium channels, are in resting state. When the nerve is about to excite, the sodium channels are in they go into activated state, they open, sodium influx happens. And as there is depolarization of the nerve, at the height of depolarization, these sodium channels, voltage gated sodium channels, are inactivated. All right, and therefore there is no further sodium possible. Sodium influx is not possible further for any other sodium channel, voltage gated sodium channel. These are special. Why? Because they are available for excitation again and again and again, even when neurons are in a depolarized state. That is, the voltage at which other channels are inactivated, this channel is still available for sodium influx. Now this is responsible for repetitive high frequency potentials in the nociceptive sensory neurons. Nociceptive means the slow pain carrying fibers. All right. So this channel has been found to be involved in two special nociceptive conditions. One is allodynia. You know what is allodynia? The non-painful stimulus like touch giving rise to pain sensation. In such a type of nociception, allodynia, NAV 1.8 channel is said to be involved. And second, hyperalgesia. When there is a painful stimulus, It is supposed to produce pain, but it is causing exaggerated pain sensation. That's called as hyperalgesia. Even in that, NaV1.8 channel is found to be involved. The gene SCN10A specifically encodes for this NaV1.8 channel. SCN, as we've said already, soluble carrier proteins are encoded by this particular gene. And now coming to the MCQ Brugada syndrome. It's a rare genetic disorder with abnormal electrical activity in the heart. And why this abnormal electrical activity? It is due to the defects in the voltage gated sodium channels. All right. In one variety of this syndrome, the defect is in the NaV1.8. So therefore, Brugada syndrome, the genetic defect of voltage gated sodium channels. There are a few variants of Brugada syndrome, and in one variant, NaV1.8 is found to be defective. And what you find as a result? On ECG, you will find the changes of RBBB, right bundle branch block, ST segment elevations in the right-sided precordial leads, or V1 to V3. So this was a summary of the Brugada syndrome and NaV1.8 as a very unique channel.